Hello. So our group is the effects stress has on nursing performance. I'm going to start off with my mixed study. Title is Predictors of Burnout, Work Engagement, and Nurse-Reported Job Outcomes and Quality of Care, a mixed method study. So background purpose. For me, even though the study doesn't necessarily specifically address stress and the effect it has on nursing, it does address the negative effects workload can have on the nurse, as well as reveals how certain work environments can contribute to a healthier and more favorable work environment, which I thought would be very useful in our discussion of ways to limit or prevent stressful work settings. The aim objective of the study was, so the purpose was, the qualitative study was to investigate staff nurses and nurse managers' perceptions and experiences of staff nurses' workload. The aim of the quantitative approach was to retest and confirm two previously developed models. So basically what they did is, this was a mixed method based on explanatory sequential study design. So they started off with a quantitative approach, which collected and analyzed data that they got from surveys. And then the qualitative study existed by performing these like semi-structured interviews and then analyzing it. And then they like compared the two when they were done. Both study phases were conducted independently, and the results assisted in explaining and interpreting the findings. So for the discussion, in an empowered work environment, nurses have access to relevant information, opportunities for learning and personal development, and supportive relationships with peers, supervisors, and interdisciplinary to achieve their goals. Workload showed to be a relevant risk factor predicted by hospital management and organizational support with a highly negative impact on emotional exhaustion and vigor, as well as on both outcome variables. The qualitative study revealed the differences between acceptable and unacceptable workload, as the capacity nurses must sufficiently meet patients' physical as well as emotional needs. Acceptable workload perceptions was when staff nurses were able to consider the patient's status and their clinical signs timely. They were able to provide quality and patient safety. High and prolonged workloads were related to nurses' decreased adequacy and efficacy, complaints of fatigue, headache, and vulnerability for diseases, as well as affects nurses' feelings of frustration, negativity, and sadness. These feelings could affect not only the individual nurse, but also the whole team and, of course, the patient. So my analysis or conclusion of this study was that I found it very informative and useful in understanding the different perceptions nurses have of workload and therefore its effect on the person and ultimately the patient. Providing a more supportive, empowered environment with access to information and enough time to think critically is essential for nurses to have a positive perception of their workload. Since workload has a strong association with work-related stress, a focus on an empowered, supportive psychosocial work environment can offer better insight into achieving a healthy workforce. Any questions?
How many patients do you guys have on your unit where you work?
That's a good question.
You work med-surg, right?
Yeah, med-surg. I gotta count the rooms. I think we have 30 on each side, so 60 rooms.
Wow. And you guys each have like 5 patients?
Max.
Max? Okay.
They try to keep it at 4, but 5 minutes.
And do you think that's a good workload for?
It's a lot. 5 is a lot. 4, I feel like, is manageable for the most part. It is very stressful still. When you add on that 5th patient, it just feels completely overwhelming. And I guess it depends on like the patients themselves too.
Maybe, right?
Yeah.
Okay. So I'll go next. So for my mixed study, I have self-care for nurses in acute care environment, reduce perceived stress. So the background of this study, further research found by American Nurse Association has found that self-care, such as practices of mindfulness and meditation, can reduce stress. So they wanted to further the study and investigate how it helps reduce stress in nurses. So the purpose of this study was to examine the impact of simple meditation self-care practice on stress and mindfulness within nurses. The hypothesis, it was hypothesized that meditation can support stress reduction and coping by including or inducing relaxed states of calm and mindfulness. Okay, the methods used in this mixed study was qualitative and quantitative methods. So the study design, the data collection was collected at baseline, at 6 weeks, and at 12 weeks, which was post-test. The intervention was self-care. A simple meditation practice was taught to the nurses at a 2-hour workshop immediately following the pre-test data collection. So as far as participants, there was 22 nurses, 19 were female, 3 were male, and they all signed consent forms. Eligibility criteria, all nurses had to be employed in a nurse director role, such as nurse leaders. They had to be working 12 months or longer. They had to be able to read and write in English, and they were willing to participate in the self-care meditation practice for a minimum of 12 weeks. So as far as the results, we'll begin with the quantitative. They used tools to measure stress, locus of control, mindfulness, and self-esteem were measured. They used a stress scale, the locus of control scale, the self-esteem scale, and the mindful attention and awareness scale. So as far as results, for the quantitative findings, within the perceived stress tool, there was a significant decrease in the perceived stress from the pretest, with a reported average stress level of 16.8 being the medium. With both had reported with a, what is it, the significant p-value of 0.009, which was not significant, right? And then as far as qualitative findings, they made focus groups within the nurses and were audio taped and transcribed verbatim. The transcripts were independently coded by 2 nurse researchers using a conventional content analysis approach. So the conventional content was used because the aim was to describe the phenomena of perceptions of stress using the self-care practice of meditation for nurse leaders without using pre-test categories. As far as themes, at baseline, the first theme they found were acknowledging stress and thriving on challenges. At 6 weeks, it was identifying self-care outcomes and incorporating self-care in professional routine. And at 12 weeks, the themes were appreciating the stress management support of self-care and non-committing to use of self-care as a tool. So as far as my conclusion, I believe that the research, there should be further research to explore the themes to go more in depth, but as far as the author's conclusion, he believes that a larger sample would be needed to demonstrate significance of the study. Okay, any questions for me?
Do you think after reading it, like the meditation that they referred to, is that something that we might be able to use in our own project at the end?
The one thing I did notice is that they had to meditate daily, and then but they didn't have a tool or like, what's it called, fidelity to make sure they were doing it. So I feel like that's where they're lacking. Like there has to be like supervision or like that they're actually doing it, because I feel like that's why it wasn't that significant. Because not everyone was following through as they consented or, committed to.
Something we should learn from
Yeah.
the project at the end.
Okay, so mine is perceived quality of work life and risk for compassion fatigue among oncology nurses, a mixed method study. So I'm going to try to run through this, but work-related stress has many sources that can cause burnout or place a nurse at risk for compassion fatigue. So it's kind of in that realm, and it talks a lot about stress, so that's why I chose this one. So relationships among the nurse, patients, and family members, as well as the nurse witnessing patient suffering, are common factors examined in studies of oncology nursing. So Lewin described the role of compassion in psychotherapy to include feelings, ideas, reactions, and interpersonal dynamics that are reflections of others' pains and sufferings. Fatigue of any kind, including that of compassion, is an important factor in the psychological and physical health. Therefore, this phenomenon and the contributing factors have been studied in a variety of ways, which will be summarized here. So the purpose of this study is to examine factors that influence the nurse's perceived quality of work life and compassion fatigue. The specific aims of the study were to describe the relationship among perceived quality of work, relationship between personal life stress and quality of work, and the nurses' beliefs about the risk of compassion fatigue. Sorry, I'm trying to skim through it. The descriptive study used mixed methods of data collection and analysis. The authors presumed that asking the nurses to engage in in-depth interviews would engage complex data that would complement and augment information collected using surveys, as well as provide solutions and insights from participants about social aspects of their work environment and contributors to work-related stress. So this is 47 beds, but only 20 nurses, sorry, in the hospital, 47 beds in the hospital, but only 20 nurses were enrolled for the participation of the study. This is because they chose,
Voluntary.
their self-selection sampling strategy. And let me see, there were no male nurses. The construct, this construct was created by the investigators and was measured using well-developed, widely used instruments. They used the impact of events scale, which is IES, and then the life event scale, which is LES. This instrument measure individual and cumulative events in the person's life that contribute to the total experience of stress. So the data that were collected were using self-report questionnaires and in-depth interviews, like I mentioned before. This was a period of 8 months, and it surveyed their level of personal life stress, quality of work life, and social demographic characteristics, and all interviews were audio recorded, granted permission by participants. So I have all the numbers and stuff in the paper. So let me jump into results. The results using SRQS, which is the questionnaire, the authors examined 3 major variables, which is nurse characteristics, personal life stress, and quality of work life. So personal life stress was analyzed as a combination of the IES and LES. This variable captures how stressors in the nurse's personal life contribute to even greater stress in the workplace that can lead to compassion fatigue. 11 of the participants had scores in the category of no meaningful impact category, 3 in the mild impact of events, and 5 in powerful impact, and 1 in severe impact. And the majority of participants reported either no or mild impact from stress with their current clinical responsibilities. However, 6 participants experienced high impact scores, suggesting that caring for patients with cancer may cause powerful or severe impact on well-being. The results with the life event scale was similar, which they talked about, like Christmas and vacation was when they had experienced the highest stress. So although the scores don't reflect an overwhelming burden or stress on nurses, they describe a major source of work-related stress as the perception of deterioration in the quality and quantity of communication between nurses and physicians. That's why I believe that it's important to also mention this, because not always is it going to be like super high stress, but there was a lot of comments and stuff that I included here that I'm not going to read because of time purposes, that do signal at being very stressful. And you know, you guys can read that in my outline. They have a lot of examples of how they experience stress, and then their recommendation on how to better stress. Sorry. Okay. Any questions?
More like a comment. I think it's really interesting that you found that, because I also found something about like mindful-based stress reduction. So we haven't really talked about fatigue compassion a lot, and I feel like that's a major component to the overall well-being of the nurse, and it's a critical aspect that we haven't really discussed too much.
Also, I want to add that we weren't really thinking about personal life stress either. Like the stress they're bringing from home into the stress they have in the workplace as well.
Yeah.
So that's something that's mentioned.
So I like that. That gives me hope.
Okay, so my article is titled Examination of Professional Commitment and Stress Management Among Nurses from Different generations. And naturally, differences are observed among generations in such aspects as perceptions, opinions, values, attitudes, behaviors, lifestyles, and communications. And with the increasing number of individuals from Generation Y, which is anybody born from 1980 to 1995, entering the workforce, which would be pretty much all of us, it's important to determine their professional commitment and how they manage stress. And nurses' professional commitment can affect their job satisfaction or retention in nursing and enhance patient safety and quality of care. So identifying these factors behind their professional commitment is extremely important. And the purpose of this study was that it was conducted in order to examine professional commitment and stress management situations of nurses among nurses of Generation X, which is born 1966 to 1979, and Generation Y from 1980 to 1995. And basically, since nursing is such a stressful career, like we all know, it's important for employers to be able to better understand how the different generations handle their stress, manage their stress, and how to keep them as part of the workforce. Some of those study questions were, what is the level of professional commitment and stress management situations of nurses from different generations? Is there any difference between different generations of nurses in the level of commitment to profession? And is there any difference between different generations of nurses in the level of coping with stress? And the study design was a cross-sectional and descriptive design, and the data was acquired by researchers from between April and July of 2016 in face-to-face interview methods. And let's see, the study group was a group of nurses. There was 175 total, 25 refused to participate. They were all working in a state hospital in Burdur, Turkey. So it was basically convenience sampling, just whoever wanted to volunteer. And some of the inclusions were they had to be literate in Turkish, and they had to be 18 years or older. And then, so exclusions would obviously be the opposite of that, people that weren't literate in Turkish and who were under 18 years of age. Let's see. So the baseline characteristics, the form was comprised of 8 questions regarding nurses' socio-demographic characteristics, so age, sex, marital status, educational status, employment status, working ward, choosing voluntarily their profession, and then their working period. So basically it was mostly the older generation, Generation X, they were mostly female, and they were mostly all married because the majority of the people in the study were from Generation X. And then, let's see, they also had a scale, a professional commitment scale. It was composed of 26 items total, with 3 subscales, including willingness to make effort, maintain as a membership, and belief in goals and values. And so those items were rated on a 4-point scale, 1 through 4, and the higher score represents higher levels of commitment. And they also had a coping strategy inventory, and it was a 30-item self-report questionnaire designed to assess coping thought and behavior in response to specific stressors. And there was 5 different subscales to that, and it was scored from 0 to 3. And so the results, like I said, mostly nurses from Generation X, mostly female, mostly married. 41.7% had a bachelor's degree, 92.6% were working as ward nurses, 97.1% were working as permanent staff, and 73.7% chose the profession voluntarily. So there was no real significance between them in terms of the sex, age, position, all of that. But there was statistically significant difference in terms of marital status, education, and length of service, just because Generation X has been working for so much longer and they're older, so of course more of them are going to be married than the younger ones. They've obviously been in the workforce longer, and then they've had more time to get their degrees. And let's see, discussion. So I think the limitation was that the study group that they had from Generation Y was so much smaller than the one from Generation X that in the future they should probably get a little bit more like balance out the number of people from the different generations to get a better idea of that. And one of the main differences was in the coping strategies inventory. The most significant was a self-confidence approach, and the p-value was 0.027. So it pretty much shows that the nurses of Generation Y are more willing to maintain professional membership, while nurses of Generation X are more self-confident. So like the younger ones are more willing to like put in work to stay into the workforce, and the older generation has more experience, so they're more confident and they'll seek social support as a method of coping with stress more than the younger generation. And I know that is interesting. So my conclusion, I guess I agree with it. I feel like now, like, we're leaning more towards trying to get the younger generation to talk about stress, and we're trying to implement more stress reduction programs and
Talk about it.
yeah.
I'm just curious, did they mention all of those who didn't want to do this study, what generation they're from?
It didn't. It just said that there was.
Like,
I know.
I wonder who dropped out.
All the
No, it didn't. It just said that 25 of them just refused to participate. So I'm not sure why they refused or what generation they're in. Yeah. That's a good question.
I like the topic because I know with different generations, they have like different ways of being managed. And like the newest generation, I don't know what their title is, Gen X or whatever, they like micromanagers. And then
Right.
like for Gen Y, we don't. Because we're not used to having those helicopter moms like the newest generation does. So I know that there's a difference in like managing, but I never considered stress reduction and coping on the different generations and how they would do it, because I'm sure there's gonna be a huge difference that I would expect. But that's interesting.
We're gonna,
Thank you very much.
thank you.